Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Two-cell two-gonadotropin theory. According to two-cell two-gonadotropin theory, there is a granulosa cell and a theca cell. First, in the theca cell, cholesterol in the presence of luteinizing hormone and cyclic AMP and CYP17, cholesterol gets converted to androstenedione and testosterone in the theca cell. In the theca cell, CYP17 is present and aromatase enzyme is absent. Because aromatase enzyme is absent in the theca cell, now the androstenedione and testosterone will travel to or they are sent to granulosa cells. In the granulosa cells, there is aromatase enzyme is present and CYP17 is absent. So because of presence of aromatase enzyme, androstenedione in the presence of aromatase gets converted to estrogen 1 and testosterone in the presence of aromatase will get converted to estrogen 2. And in the adipose tissue, androstenedione in the presence of aromatase, it gets converted to estrogen 1.
So this is two-cell two-gonadotropin theory where there is involvement of two cells, theca cells and granulosa cells and gonadotropins, that is androgen, testosterone, estrogens.
thank you and thank you for watching.